President Joe Biden ended the national COVID-19 emergency weeks before it was set to expire. The future of certain resources, including free access to vaccines, is uncertain. So right now, every county in Kentucky, except for one, is experiencing some low cases, but some of the state's most vulnerable populations still remain unprotected. So the Kentucky Nurses Association is teaming up with Family Health Centers for a series of COVID vaccine clinics. This is Melissa Mather. Thank you for joining us today, Melissa. Talk about some of the immediate concerns that the Nurses Association has when it comes to vaccines.
So for any of us working still in public health, we know that COVID-19 is not going away anytime soon, even if the public health emergency has ended. And my concern is always that, COVID's still going to be one of the leading causes of death for Americans this year. 200 people die every day. So the repercussions is still very, very serious. And when the public health emergency ending, people have in their mind that COVID is somewhat not an issue anymore, when in reality it really is. And
we think that through your studies and through information that's out there publicly, some of the information about COVID and the testing and the vaccines, those things are not free. Does that worry you all when it comes to people at home maybe thinking they can just pop out and grab one of those tests or pop out and grab a vaccine for free?
Yeah, absolutely. So one of the things that's going away are the free home test kits. But really, for a place like Family Health Centers where we care for anyone regardless of the ability to pay, if you don't have health insurance or if you're paying out of pocket because you have a high deductible, those things will cost maybe hundreds of dollars. And that's a real barrier for people when you're living check to check and, but you're sick and you don't really know what to do. So it is a big concern.
So if someone wants to get vaccinated at one of those clinics, what do they need to bring with them and what do they need to do ahead of time?
So they really don't need to do anything ahead of time. Maybe just make sure that they are feeling well, to bring with them maybe some sort of ID just so we can check the spelling of your name, because we want to make sure that we're giving the right dose to the right person. And that's it. Maybe a friend. Please bring a friend that's not vaccinated or needs their bivalent. That's it.
Okay, perfect. Melissa, thanks so much for joining us. Now, there are 7 more clinics throughout May. The next is at Forward Ministries on Hikes Lane. It's Sunday from noon until 5. The Pfizer vaccine and booster will be offered for ages 5 and up. And if you need more information, you can go to fhclouisville.org/COVID-19.